Hello everyone, my name is Alyssa Gonzalez. I am a nurse practitioner student at Texas State University, and today I will be presenting a case that highlights an ethical dilemma in healthcare. This case is about a homeless man named Jesse who was brought into the ER by paramedics after a patron found him confused and in distress in the street. The patient was diagnosed with severe infection in both legs, and a mass was found in his lungs that is suspected to be cancer. Physicians are recommending a biopsy and bilateral amputation due to the severe infection in his legs. The patient quickly denies the amputation but agrees to the biopsy of the mass in his lungs, which does show lung cancer that is treatable but incurable. Jesse denies treatment, as he has in the past for other infections, and wants to be discharged, but a psychiatric evaluation leads to an opinion that he lacks the capacity to make informed healthcare decisions. The primary ethical dilemma is the conflict with respecting Jesse's autonomy versus beneficence and ensuring his well-being. The healthcare team must determine whether he can make informed medical decisions or if further interventions should be pursued to ensure his medical well-being. A single provision from the ANA Code of Ethics that applies to this case would be Provision 1. The nurse practices with compassion and respect for the inherent dignity, worth, and unique attributes of every person. As healthcare workers, we must respect our patients' autonomy, even if we personally disagree with their decisions. However, we must also ensure that they're making informed decisions by providing all necessary information about their condition and potential outcome. We can ensure this by providing comprehensive information about their conditions, prognosis, treatment options, and support options. An article by Bowen, Savino, and Irish highlights the health disparities faced by the unhoused population. They are a significantly vulnerable population and often incongruently suffer from serious mental health conditions like substance use disorders. They also suffer from chronic infections, violence, and food insecurity. This article highlights that homelessness also impacts patients' healthcare decisions because many patients feel unsupported in their decisions, or they feel like it's pointless to pursue care or treatment because they do not have a home to go to and heal in, and they do not have family support. It also highlights our moral obligation as healthcare workers to treat these patients equally and fairly as they deserve by doing our best in educating them and connecting them with resources that could provide housing and allow them to heal in a safe environment. Regarding Jesse, we have made our best efforts to inform him, educate him, offer him treatment options and housing support options, but he is still refusing. This is his right after we have done our job of diagnosing, developing a treatment plan, reevaluating his capacity to make decisions, and providing him with treatment options and housing support options. I believe the single best course of action would be to respect Jesse's decision to deny treatment and discharge him as he wishes. Before doing so, we must ensure he has the capacity to make decisions by ruling out any infections that might be causing delirium or impairing his ability to make decisions, and ensuring that he is not under the influence of any substances. Once he is found to have the capacity to make informed decisions, we must comprehensively educate and inform him of the risks and consequences of denying treatment. We must also reiterate that housing assistance is available, and we can connect him with a social worker to help achieve this. One positive effect of our course of action would be that we are honoring Jesse's decision and respecting his autonomy. One negative effect would be that his condition will likely worsen and lead to death, and later on he might regret this decision of refusing care. As healthcare workers, I believe it is in our nature to want to pursue interventions that we see fit to help our patients, but at the end of the day, it is their life, and we must respect their autonomy and their decisions. Thank you for listening.